Welcome to our channel Let's Talk. I am Dr. Karan S.K. Mathur, formerly head thyroid clinic at Institute of Nuclear Medicine Allied Sciences, Timarpur, New Delhi, and fellow American College of Clinical Endocrinology. I am practicing thyroid disorder for last 30 years. Today we are going to talk about thyroid and in particular hyperthyroidism. So thyroid is a gland, is an endocrine gland, is a butter-shaped gland located in the center of the neck. The function of thyroid gland is to produce hormone T4, T3, which is essential for maintaining our human metabolism. And this metabolism is comprised of three main activities, that is mental activity, physical activity, and reproductive. So thyroid hormone secretions are also controlled by a negative feedback, which is going from the blood to the brain, and brain in anterior pituitary part of the brain, from where the thyroid stimulating hormone, that is TSH, commonly tested blood test, is released, and they control the release of T4, T3 from thyroid gland. If the T3, T4 goes down, TSH goes up. Inversely, when it goes up, it goes down. So thyroid is a very important endocrine gland, and the commonest disorder we see today's practice is thyroid disorders. The common thyroid disorders are hypothyroidism, where the function of release of thyroid hormone reduces and causes low metabolic activity in human body. We have already spoken about it in our last talk. Second common is hyperthyroidism, where the hormone secretion goes up and more hormones are released from the gland and produces overactivity of the human metabolism. We'll come to symptoms later. Another is goiter or multinodal goiter or simple colloid goiter. They are because of iodine deficiency, or there are so many other causes of the goiter. They can be simple benign goiter, they can be malignant goiter, or they can cause a lot of other goiter. Now, thyroid cancers are another topic by itself. Today we are going to focus upon hyperthyroidism. As we said, hyperthyroidism is oversecretion of thyroid hormones, and which causes increased metabolic activities. The commonest symptoms of hyperthyroidism which we see in our practice is because of insomnia, that is lack of sleep, weight loss, fatigue, tiredness, tremblance, that is trembling of hands and feet, hyperdefecation means increased bowel frequency, and there can be many other symptoms which can be made like increased sweating, nervousness, anxiety. These symptoms can give a high level of suspicion to look for the thyroid disorder. Having gone through these disorders, we will recommend all the individual patients or persons who feel these symptoms should consult their doctor to get them further evaluated in this, because it is a controllable disease. We are not going to cure thyroid disorders, particularly Graves' disease. The commonest causes of thyroid disorder are A, autoimmune disorder. Among that is a Graves. Graves' disease is known by the scientists who discovered that first, and it causes increased metabolic activity and is one of the commonest hyperthyroidism, where we see there is a small enlargement of gland, there is exophthalmos, that is eye sign seen in hyperthyroidism, eyes are bulging, nervousness, trembling, as we discussed the symptoms earlier. The second common disorder of thyroid is we call nodular goiter or multinodular toxic goiter. The cause means nodular goiter becomes the nodule form and this secretes more hormone. Another entity in this goiter thing is solitary nodular goiter, a single nodule which becomes autonomous and secretes hormones irrespective of the availability of other parameters. Third is thyroiditis. Thyroiditis is an infective disorder where there is some infection. It can be because of the viral infection. It can be also possible in postpartum, post-delivery of the ladies. So thyroiditis is an entity where there is a transient increase in thyroid hormone, but they don't remain for long term. They can be self-limiting, they become settled down, or they may long term convert into hypothyroidism. The three commonest causes we see in our practice of thyroid hyperthyroidism. Then how to evaluate, how to diagnose hyperthyroidism. The first commonest test on high level of suspicion by doctor, we go to the thyroid function test, that is FT3, FT4 TSH or T3, T4 TSH. In this test, normally it is done fasting, but there is no indication to do it fasting or otherwise. It can be done any time of the day. And if we find abnormalities in T3, T4 and TSH, that give a suspicion or diagnosis of hyperthyroidism. T3, T4 can be normal sometimes and TSH suppressed. The condition known as subclinical hyperthyroidism they require further evaluation or further monitoring. And when T3, T4 goes up, TSS goes down, as we said before. Second important test for the thyroid function test, which we differentiate between thyroiditis and thyroid function, is radioactive iodine uptake studies. Meaning by, we give a radio labeled capsule to swallow the patient, and under the GABA camera spect, we evaluate the uptake of iodine into thyroid gland. If it is high, more than 5 or more than 25 after 24 hours, it gives indication that thyroid gland is getting more and more iodine from the blood and causing hyperthyroidism. So there needs a treatment for hyperthyroidism. But in thyroiditis patient, this level will be low. So that means we don't have to start anti-thyroid medication then and evaluate them further. So these are the tests which are done by a doctor to evaluate back to how to start the treatment of thyroid. So one having come to a diagnosis of hyperthyroidism, how to manage them, how to treat them. The first line of therapy is a medical therapy. In that, we try to control the hypermetabolic symptoms by giving beta blockers. That is propranolol, ciplar, indrolitol. They control heart rate, they control hypermotility. So these are symptoms given by beta blockers. Then the thyroid specific drugs. The best drug is methimazole or neomercazole, which is given in doses required to the patient weight and profile. And these drugs are given for a long time. We evaluate the patient periodically. Once the patient comes in a normal range of thyroid function test, we monitor and maintain the dose to a desirable level. Thyroid medication may be required for a very long time. Normally we divide into 24 months and then we decide whether to continue or not to continue. However, in my clinical practice, I have observed large number of patients require maintenance dose of thyroid medication like neomercazole to keep them in a euthyroid state. The second line of therapy, which is commonly practiced now, is a radioactive iodine therapy, means radio ablation. We give the patient, depending on the radio uptake studies and the profile of the patient, size of the gland, required quantity of radioactive iodine to ablate the gland. It is done under the Department of Nuclear Medicine. All the nuclear medicine experts, they calculate those and give the patient radioactive therapy. This therapy is it is a very good therapy. It ablate the thyroid gland and reduce the overproduction of thyroid from thyroid gland. Hence, the make patient euthyroid. It takes some time to become active or effective, and once it becomes effective, it turns patient from hyperthyroidism to hypothyroidism. And these patients may require long-term thyroid hormone replacement therapy. So we have to select the patient, do the test, and treat them accordingly. And radioiodine therapy is very much indicated in these respects. I particularly recommend those young girls, those who are pre-marriage or those who are yet to get pregnant. If you give them radioiodine therapy, they become hypothyroid. Their maternity period will be very safe. And third thing which we also do is a surgery which is not done commonly now. Earlier, when the goiter was very big or big goiter and the thyroid gland thyroid hormones are not getting under control by medication, then the surgery was indicated. But present day practice, surgery is not a very common line of therapy in the hyperthyroidism. Just to summarize in few minutes, the thyroid gland is a gland in the center of the neck, secretes hormone T4, T3, which helps in our metabolism. Over secretion of T4, T3 hormones causes suppression in TSH and causes symptoms of hyperthyroidism, which we enumerated. We must be very suspicious of these symptoms, means unwanted weight loss, palpitation, lack of sleep, fatigue, tiredness, and not involved in the human day-to-day activities. They should be evaluated. Once we diagnose thyroid patient by doing blood tests and other tests, we must treat them, and patient should be guided. This treatment is a long-term therapy. It is not that we treat for 5 days or 10 days or 3 months. They require long-term. Along with the medication, they should be periodically follow up so that they don't go haywire. That's the basic thing of a thyroid disorder. Thank you so much.